So my name is Joelle. I'm one of the researchers and academics at Queen Mary's University of London, and I'm also a dentist at the Royal London Dental Hospital. So the My Story, My Words, My Mouth project is a film really that places community returners at the heart of the project. So the film is written very much by community returners, and it's their experiences. So it really just is a platform to capture and project their life experiences and their stories to get people talking about some of the oral health issues around this group. So with community returners, so they're people that have had contact with the justice system and been in prison at one time or another. So what we know about their oral health in prison is that they find it really difficult to access care while they're in prison. They go into the system with poor oral health, and because they find it so difficult to access care, they're often left in a worse position than when they went in. So we wanted to kind of look at what happens to their life afterwards. Where do these people go? What kind of experiences do they have of accessing healthcare? So the main themes that come up through the film are things such as stigmatisation, difficulties in accessing healthcare records, and really that fear of accessing care for the first time and that worry about what other people might think about them. So we really hope that this film manages to start some conversations about the oral health of this group and can be used as a platform to kind of promote some change and make change to the system.
I have to say probably very little. It's not something I think when you're working as a general dentist or within a restorative department, it's not something that you see very often, because I know there's a lot of access issues for these patients, so probably very little is the honest answer to that.
I have had previous experience like 20 odd years ago where I worked in a hospital and we had patients who used to come in from Dartmoor prison and we had to look after them and stuff, and it was always a slightly scary kind of proposition for us because we'd often be going to see them on our own, so it was something that made me anxious occasionally, but I was also aware that these people have, they've got higher needs than a lot of our population and are definitely it strikes me as there probably are a population that do have issues and would need extra help with their dental needs.
When I first heard about this film, I have to admit I had not considered dental care in prison at all. I hadn't really thought what the impact would be around dental care, and in terms of community returners and people coming back out from inside, I hadn't considered it, but now that I think about it, I can see that it would have, I imagine, quite a big impact on how people feel when they get out.
Dental health is probably quite overlooked in general when it comes to health, or at least it seems like that to me. And actually people's mouths and they're so integral to so many parts of your life. It's a very intimate thing. You speak, you eat, you engage, you present to the world that way. And I can imagine that, coming out of a prison or being an ex-offender, that might be a nerve-wracking experience anyway. And if you're having sort of thoughts or feelings about your mouth and your teeth and stuff, then I think that could be, probably something quite important to consider and think about in terms of someone's overall health, but also, in terms of how they feel engaging in the world. So I was really interested about the project, and I'm really curious to see sort of the film and what people think and how this important issue gets presented.
And I'm curious really around what dental health will mean in the bigger sense, and that's why coming to see a film about it, it really drew me to it, because I guess I'm imagining I'm going to get a bit of insight from the human perspective.
I'd like to know about sort of the issues that affect people, how difficult it can be to access dental care, and the sort of psychosocial aspect of maintaining your dentition, which kind of can get neglected when you have other priorities, which I assume that this sort of patient cohort, this group of people will do. So for me, I'd like to find out a little bit more about the difficulties people have, and to see if there's things that people like myself, others in the profession can do to help.
going to prison and then coming out, it already is difficult. And then you think of the different barriers they face. You don't think that dental care and oral health is another one, and we know the impact that it can have. Simple things like what we know right now in the climate, finding a dentist is difficult. People are going to all their appointments to make sure they're not deregistered. A simple thing like the stigma of going to prison. He has not, or you haven't attended appointments, you've taken off a register, you can't find a dentist. When your self-esteem and your confidence is low, it's very difficult. If you've got dental problems, oral health problems, that cycle is vicious. So it's such a small thing I didn't even think of.
I was expecting it to be people's stories, like a documentary. So the fact that it was fictional, first of all, it was exciting because for me, I was like, okay, here's two characters who've been created by people who've got direct experience, so they can put their emotions, they can put their insights into it, but also be one step away from actually sharing on camera. So I thought that was a brilliant choice. It was beautifully shot, the acting was really fantastic, and it just made me think. It made me think about how people feel when they're inside, how a small thing like dental care is actually a big thing, and when people are returning to the community, all these interactions that they have with health systems have a big impact on how they feel. And I thought the bit at the end, when one person who'd been out a bit longer than the other one just gave that little boost, was really moving.
I think it's really worthwhile, and it was really quite eye-opening for me. And I think it shows kind of my naivety about some of the issues that people face. For example, something that struck me was when the receptionist sort of asked what your previous address was and the stigma associated with that, and actually the thought that someone might be a little bit embarrassed to come back to the dentist who they've sort of been treating them probably their whole life and say, oh, where have you been? I've been in prison. So yeah, there's a lot of barriers that you probably don't think about, which I think films like this can sort of open your eyes to.
One thing is, when you go to prison, you are in essence under the government's care. Okay, so basic necessities like pain and dental care should be met. So when someone's got acute pain, acute infection, it is their responsibility to provide access to healthcare. So to hear things like waiting times of 12 months, 18 months, I'm sure when you're moving prisons that then gets reset. It's not fair. It's not fair to be placed in a cell with severe pain that's debilitating for long periods of time. It is crushing. So that's one experience. I'm sure there's different ones, some worse. So that is something you do learn about as well.
So I was quite struck by, just what it's like to engage with health services, and how clumsy that can be and how much better we could do at improving health services to make people feel more comfortable, more accepted, less stigmatized. So, the scene when the person is trying to kind of just register, and even the barriers at that level, I find that quite frustrating to see, because it seems like stuff that could be easily improved, but also, so important in helping understand what different people's experiences of seeking healthcare are.
I think one thing is about the voice that it gives to people to reflect on their experience. I think it really raises an important issue. I will be honest, it had never occurred to me to think about dental care in prisons. And clearly, there's a really serious lack of provision for people. The idea that somebody would be left, have their teeth taken out, infection, that this causes really serious problems for people. It's not acceptable. And I think that when people come back out into the community, obviously they need good dental care, but they also need support and respect. And I think that this film highlighted that for me really clearly. And it's a really good call to action.
That to me kind of makes sense, because that's something the general population face anyway, without this extra kind of layer of difficulty on top. But what I didn't really appreciate the thing when they were talking about what was his last address, and that bit, that was really powerful as well, because obviously that's the kind of thing I'm sure does happen. And it was clearly an experience that someone had been through, which was just, again, very upsetting, and it's going to really put you off, isn't it? So
this form of media is far more accessible and can reach a wider audience. So, yeah, amazing, and really congratulations on that. As for how that will impact my sort of actions going forwards, it's something I'm going to have to think about in my day-to-day work, in how I interact with people who perhaps have been to prison previously. No doubt about it, in my working practice, I will encounter some of these individuals, and I think I need to take into account and think a little bit more about the challenges and the barriers that they face, and try and do my little bit to help.